Good morning, welcome, and thank you for joining us for our Northern Light Health Good Health is Good Business Zoom conference. The Delta variant surge is still worsening in Maine. On any given day, 90% or more of the people hospitalized in the ICU and on ventilators are unvaccinated. These people are younger and basically healthier than we saw a year ago. And while every one of us is so over COVID-19, COVID-19 is far from over with us. This is all taking a toll on everyone, and our mental health is a significant part of the evolving story. Today, our topics will include latest on COVID-19, boosters, vaccines, and supporting our mental health. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Beacon Health. I'll be your moderator for the next hour. Our panelists today are Dr. Elizabeth Marnick, Assistant Professor of Molecular Biology at Hudson University with special expertise in immunology. Dr. Clifford Singer, Chief of Geriatrics, Psychiatry, Mood, and Memory Clinic at Northern Light Acadia Hospital. Dr. David Prescott, Associate Professor of Health Administration and Public Health at Hudson University. Yamaya St. Clair, Employee Assistance Program Counselor at Northern Light Workforce. Angela Felicia, Director of Healthy Life Resources Program at Northern Light Acadia Hospital. Dr. Jim Jarvis, Director of Clinical Education at Northern Light Eastern Maine Medical Center and Physician Leader for Vaccinations and COVID-19 Incident Command at Northern Light Health. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. A reminder, this hour is for you. If at any time you have a question for our panelists, please use the Q&A function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Dr. Jarvis will start us off with a COVID-19 update. Dr. Jarvis?
Thank you, Ed. I think each week you add more to my title. I'm not sure if that's because you're giving me more responsibilities or what. But so the last time that I spoke to this particular group, things have changed dramatically since then. And so I use this as a snapshot, as just to kind of talk about where we are in the pandemic from one standpoint, and then I'll talk a little bit about others. So if you look at the graph at the bottom, this represents the number of tests that Northern Light Health Laboratory runs. And so they run tests from doctors' offices within Northern Light and without, as well as hospitals within Northern Light and without, and of course at our Swab and Go sites. So this is a very inclusive grouping. And if you look all the way to the right, that was just yesterday, and we did over 1,400 tests run. That is a record. And you can see that the graph line continues to show a trend of increasing. So each week over week, we are testing more and more individuals. Then if we look above that and we look at that positivity rate, remember the positivity rate is the percent of positive tests divided by all the tests that we run. We like to look at a 2-week snapshot because that gives us a better trend than the 1 week, but both of these are alarming. 11.51% is again a record high for a 2-week positivity rate. Again, this is not for the state, this is for Northern Light Health, and so it does tend to run a little bit higher than what we see state numbers are, but the state also has running tests that we expect to be negative, such as pool testing in schools and surveillance testing that's done across universities and some businesses. Northern Light Health really isn't doing that, and therefore ours is much more a snapshot of what's out in our community. So what this says is that out of every 100 tests we run, between 11 and 12 of those tests will come back positive. That's a significant number looking at our community. I've often been asked, well, isn't that just because you're testing all of the people who are sick? And that's not true. So we run tests for lots of different reasons. We're certainly at our swab and go sites testing individuals who are symptomatic, but we also test asymptomatic individuals for a number of reasons. They've been exposed to somebody who's had COVID. It may be a work-related reason why they're getting those tests. And then, of course, we continue to test everybody that comes into our hospitals for admission, and then certain people are coming in for certain procedures. So this really is a good snapshot of what's out there in our community. And then if we look what that translates to into severe illness, we now had a record high of number of admissions to Eastern Maine Medical Center, and across our entire health system, we are now approaching a record number of individuals who are admitted. Those people who are admitted, as Ed said in the opening statement, they tend to be younger than we saw before and healthier than we saw before. That's not to say that the people that are over the age of 70 still don't make up the largest number of people who are sick with COVID. They still do, but we didn't see this trend towards younger and healthier individuals. And then they tend to be sicker. So almost 1/4 of the patients admitted to Eastern Maine Medical Center are now on a ventilator. You've heard me speak before saying that we try to avoid ventilatory support in individuals with COVID because we know that that actually has a higher mortality rate than if we're able to treat them with high flow oxygen alone. If we need to resort to ventilatory support, that's because they're that sick. Next slide, please. So booster shots, this is the big story that's out in the news right now. And really what we need to remember is, one, all the vaccines that are currently authorized to fight COVID-19 in the United States, that would be the Pfizer, the Moderna, and the Johnson & Johnson, are still highly effective, not only to against all of the viruses, the mutations that are causing COVID-19, but specifically the Delta variant, which right now is far and away the predominant strain across the state of Maine. So why are we talking about booster shots? Well, if I told you a year ago that we had a vaccine that was coming out that was 65% effective in preventing hospitalization and death, we would have all been jumping for joy. What we found is that we had vaccines that were able to prevent those two conditions 90 to 95% of the time. And now we're starting to see that rate wane, maybe down to that 65% that last year we would have been ecstatic about, but we get spoiled here in the United States. And so that's the reason why we're talking about booster shots for the general public. But right now the data is a little bit confusing and unclear, and we hope that in the coming days we will have more clarity on whether or not booster shots are recommended for the general population. What we do know is that an additional dose to the original series for the messenger RNA, that's the shots that are from Pfizer or Moderna, that it is advisable for people who are severely immunocompromised to get an additional shot as part of that primary series. So we know that certain vaccines, we talk about that with the DTaP for kids, that it requires a series of vaccines to get as high immunity as we can. This is kind of the same thing for that. So stay tuned for boosters for the general population, but if you or someone that you love is immunocompromised, reach out to your provider to see if that third shot is advisable for them. Notice that I didn't talk about Johnson & Johnson. Right now, there is no recommendation for people who receive the Johnson & Johnson vaccine to receive an additional dose, either because they're immunocompromised or in the general population for boosters. Next slide, please. So I want to talk a little bit about monoclonal antibodies, and you probably heard a lot about those in the news media. So monoclonal antibodies are a synthetic antibody. So we talk about antibodies all the time in protection of against infectious diseases. So these are a specific antibody that attacks a specific portion of the virus. So we use these in two situations. One is in people who are infected with the virus and have mild to moderate disease and an underlying condition that puts them at risk. That's the overwhelming majority of what monoclonal antibodies are used for across the state of Maine. And in fact, due to a shortage of monoclonal antibodies, it's our recommendation. That's really what we stick to. There is an indication to use it prophylactically, meaning to prevent the virus from infecting somebody if they are in an area where there's a large outbreak, particularly in a long-term care facility or something like that. But what is this slide talking about? Well, this slide talks about how effective these monoclonal antibodies are. So this is a population of about 100 people in a community. If they were all infected, if we did not treat that population with monoclonal antibodies, 7 of those individuals would be admitted to the hospital and 1 of them would die. However, if we were to treat all of them, that's what this graphic represents, only 2 of those people would result in hospitalizations and it would prevent all deaths. And that's a significant thing for us to talk about. And that's what monoclonal antibodies do. Again, a very narrow window and indication for individuals who have mild to moderate disease and underlying risk factors, which includes age over 65 as just a solitary risk factor, should inquire about getting monoclonal antibodies. This is not a treatment for severe disease, and it is not something that we use in hospitalized patients, that we're often asked by families as their family member is suffering from COVID-19 in our hospitals, can we try this? It has not been shown to be effective in preventing worsening of disease or preventing death in people with severe disease. So I believe that's my last slide. No, I'm sorry, I have one more. So what not to do when somebody comes down with COVID-19, and I really want to stress this. There has been no supplements or medications that have been shown to reduce the risk of contracting COVID-19 other than the monoclonal antibodies that I just spoke about. And excessive taking of supplements can be harmful. And we know that there are many misinformation out there about if you take this particular supplement or this particular medication, it could help either prevent COVID-19 or prevent you from going from mild disease to severe disease. There are many things that are being studied right now, but none of them have been proven and none of them have been approved for that. So my strong recommendation is if you, one of your staff, or someone that you love comes down with a positive case of COVID-19, they should be reaching out to their provider about appropriate measures they should take. So with that, I think I'll turn it back to Ed.
Well, thank you, Jim. Next up is Dr. Marnick, who will help us understand the immunology of breakthrough infections. Liz?
Thank you. So I want to address this because I think all of this talk about boosters is making individuals who are vaccine hesitant or who've gotten vaccinated worry that this means that the vaccines are not working. And I want to reassure you that they are still working, as Dr. Jarvis already mentioned. And I'm going to start here on my far most left graph. And this is showing just the vaccine coverage by age group for the state of Maine. And we are seeing that the highest percentage of the population who are vaccinated are those older. And we're seeing that the younger population is where we have the lowest vaccine rates. And then if we move to the next graph, looking at COVID-19 cases by age, we see that the graph shows that those who are having the highest case rates of COVID-19 are those with the lowest vaccination rates. So that's really showing us that the unvaccinated are helping to drive this COVID-19 surge. And some of these are individuals like kids under 12 who are not eligible for vaccination. And we are hoping that will be the case soon, that they'll have a vaccine. But right now, those kids are at risk and they don't have the option to get vaccinated. And then the other 2 graphs that I want to talk about are looking specifically at total infections or at hospitalizations or death. And we do know that breakthrough infections happen, but the light green represents total infections or total hospitalizations and deaths, and the dark green refers to the amount of those that are breakthrough infections. And we can see that the rate of breakthrough infections is much, much, much less than what we're seeing for total infections. And then we go to hospitalization and deaths, we see that that is also the case. So yes, breakthrough infections happen, but the largest case increases that we're seeing, the hospitalizations and deaths that we're seeing, are in those unvaccinated. Next slide, please. And now I want to talk about how this works from an immunology perspective. So I'm going to talk about 2 cases. So where we have somebody who's infected and unvaccinated versus what happens when somebody is a vaccinated breakthrough infection. So for somebody who is unvaccinated, when that person is exposed to SARS-CoV-2, which is the virus that causes COVID-19, that individual will turn into what I like to call a virus-making factory, because viruses turn that individual into a way of reproducing itself. So once that person's infected, that virus has mechanisms that actually help to evade your immune response, because it doesn't want your immune response to be able to identify it, because then you'll kill it and the virus won't be able to reproduce. So when somebody unvaccinated, it takes a while for their immune system to be able to identify that you've been infected and that something is going on. And in the meanwhile, while you're waiting for your immune system to kick in, that virus is spreading throughout your body and infecting and damaging multiple cells. And this is why we see individuals developing pneumonia and other severe complications of an infection. Eventually, if this person can survive this infection, they will have their adaptive immune response kick in, and that will help them clear the infection. And then after that, those adaptive immune response cells will eventually form memory that will help protect the individual. But how long that protection lasts is still unclear. But then if we go to somebody who is vaccinated, there are two things that can happen. So either that person will be exposed and they won't be infected, because we see that vaccines are still reducing the risk you'll be infected if exposed. And that's because we have high levels of circulating antibodies, and the antibodies that are circulating after vaccination, they can help block infection. So eventually we do see that those antibodies start to wane. And as they start to wane, that could result in a person being exposed after vaccination and then becoming a breakthrough infection. But in that individual, they've already been through this process of identifying the spike protein in the vaccines as foreign. So as soon as that individual is exposed to the virus, what will happen is that their immune system recognizes that spike protein as foreign. And then their immune system will very quickly and rapidly turn on and start attacking the virus and the cells infected with the virus. So then this individual will clear the infection much faster than somebody unvaccinated. And we do have data that supports this. And they have a much more mild infection because, again, you don't have to worry about the virus spreading throughout your body as much because your immune system is already primed and ready to go. Now, the last thing I want to mention is this whole talk about boosters again. So as Dr. Jarvis mentioned, there is some debate about whether or not boosters are really even needed right now. And I definitely think that's a valid debate. And it'll be interesting to see what the FDA ends up deciding. I think they're meeting this week to talk about it. But one of the reasons individuals are pushing for a booster is because a booster will increase circulating antibody levels. And an increase in circulating antibody levels will help to even decrease the risk of a breakthrough infection occurring. Because the higher the antibody levels, the less likely you are to become a breakthrough infection in the first place. So we may, if a booster ends up being rolled out, we may see that breakthrough infections will become even less common because of that. And then as a consequence of that, we'd also see less cases of hospitalized breakthrough cases. But again, we need more data to really know, and hopefully we'll get that data soon. And with that, I am done.
Well, thank you, Dr. Marnick. I was thinking to myself, boy, that's a great graphic to really explain the situation, but it was captured even better in the chat room. I think this is the most persuasive slide regarding addressing vaccine hesitancy I have seen to date. So I think you really created a fantastic tool for all of us to use and share. So thank you, Dr. Marnick.
You are welcome. So
next is Angela Felicia, who will speak about mental shortcuts. Angela?
Thank you so much. And thanks, Dr. Marnick, for your great information, and of course, always to Dr. Jarvis for his updates. So one of the things that I thought was really important for us to talk about, particularly in light of the high cases of COVID, breakthrough infections, vaccine hesitancy, is to just provide a little education, information about some mental shortcuts that all of us use that in general are helpful. However, sometimes they actually cause us to make some not so great decisions. So in general, mental shortcuts are our brain's way of making sense of new information. Our brain likes to do things fast. So when we get new information, the brain tries to make sense of it. We even try to match it up with things that we might know or have heard of. And then we think, voila, I think I get it. Next slide. Sometimes we don't get it, however. Sometimes we're wrong. And occasionally our brain engages in mental shortcuts that give us some wrong information. So a couple of ones that are really common that I have put on this slide, I really wanted to highlight two for us. The availability bias is a mental shortcut that is quite common, and the social media companies, in fact, use this availability bias to shore up our news feed. So when you Google something, you'll see it in your social media feed, right? So oftentimes we'll think, if I've seen this or I've heard something over and over again, that in and of itself must be true. However, that's often misleading because of this availability bias. The other piece that I really wanted to highlight here on some of these mental shortcuts is we often link two things together that happen at the same time, but don't have any connection. That's a false cause. So I actually used an example from a professor of mine that I had in college because it really stuck with me. Both of these things are true. Ice cream sale and murder rates increase in the summertime. Those things happen simultaneously. Both of these things are true. So a false cause would be to say that, aha, ice cream actually causes murders. Now that's a pretty silly example, and none of us would say that, but it really illustrates how sometimes our brains can make these false connections between two things that are not linked. We often do that, particularly when there's new information or hard to understand information. The other thing that I think is really important, oh, thank you. Actually, thanks for moving forward. So one of the ways that we can combat or just be aware of these mental shortcuts, is to, one, be aware that we all do these. These are totally normal. So we want to think about, if we're looking at, say, that naturalistic bias, we want to think about, gosh, how are the ways that science actually helps us? We're coming to you today from the magic of science. Without science, we wouldn't be able to be having this. So oftentimes, in fact, science is the thing that we want, not necessarily nature. Weighing facts equally is really important to prevent or help mitigate some of that mental filtering. And our optimism bias, we do tend to be more optimistic than perhaps we should. So sometimes it's good to take a really realistic approach to risks in our life. Next slide. And then I mentioned that availability bias. So oftentimes, again, thinking about your social media feed, what is available to us, we assume is correct. So we really want to seek out diverse sources of information and ask diverse people or contacts so that we're getting the best information possible. We do tend to be, as a human group, averse to losses. So we do want to consider what is gained by a new activity or gained from new information. And then, of course, if I could leave you with any remembrance today, is this false causality. Remembering that just because two things happen together simultaneously, ice creams and murders, does not in fact mean that they are somehow linked.
Well, thank you, Angela. One of my takeaways is certainly ice cream is always well used in an example. So thanks for that.
Agreed.
Okay, next is Dr. Prescott, who will speak about the mental health impact of COVID-19 and stress reduction. Dr. Prescott.
Thanks very much, Dr. Gilkey, and thank you, Angela. Those cognitive biases are hugely important as we try to process all this information on COVID. And I would point out my training, in addition to public health, is clinical psychology. People often don't like it when you challenge them on their biases, but over time, you can often get them to take a little more balanced view. I want to talk today a little bit about what we've learned about the impact of the pandemic on our mental health as a population. It's pretty commonly agreed that the pandemic has been stressful, but the statistics, I think, are eye-popping or alarming. How much that has impacted us over the past year and a half or so is quite significant. And then I want to talk a little bit about, particularly those of you that are in leadership positions, or how we can begin to address this mental health problems that are coming up with COVID, how you can begin to perhaps address them in the workplace. There is also certainly treatment options if people develop more severe mental health disorders, although I will say similar to the health system in pattern, right? We are struggling in the mental health world right now with the shortage of providers, and in Maine and the greater Bangor area, it is getting increasingly difficult to respond to people's needs in a timely way. There's lots of wait lists and delays. But let's back up for a minute and talk a little bit about what we're learning at a 10,000 foot level nationally about the impact of COVID-19 on our mental health. So I'm going to be showing you some, and we have here a graph from the Census Bureau. In addition to collecting the every 10-year census, they collect data in a monthly household pulse survey. So they're surveying people to get the pulse of our country on different things. And if one of the things they do is they look for people reporting any clinically significant symptoms of anxiety or depression, or both. So if we look at that, what's happening, this is a national survey back just as the big pandemic was beginning to emerge in December of 2019. We see that about 10%, if you look at the blue line, of the US population was reporting at least one clinically significant symptom, those things we look for on screening to see if a mental health disorder exists, of either anxiety or depression. If we look just 12 months later, again at that blue bar, we go from just over 10% to over 40%, 4 out of every 10 Americans are reporting clinically significant symptoms of an anxiety disorder or a major depressive disorder. So that a fourfold increase, this is tremendous. If you take a look, the most recent data put out in August, we're down to just over 30%, the blue bar, of people reporting clinically significant symptoms of anxiety or depression. But I'm sure you can all see that a third of the people in our country reporting these symptoms is a bunch. So it is taking a huge toll on us. Let's take a look at the next slide. I wanted to check and see how Maine was doing, whether Maine was looking like we were running on the national average or above or below. And it looks like the gray bars being Maine, the yellowish orange bars being the United States, that Maine is looking very similar. So this is that August data, again, most recent. So Mainers appear to be experiencing the mental health impact of the COVID pandemic very similarly to those in the United States. So certainly something that, in addition to all the other things we're having to deal with COVID, looks like it's a very real problem here. And we'll take a look at our next slide. Interestingly, the pandemic's impact on our mental health does not appear to be equal for all age groups. So this is a striking statistic. I pulled the August numbers, but this will hold true for any month since the start of the pandemic. If you look at those clinically significant symptoms of anxiety or depression by age cohort, you see this downward stair stepping. So lower bars there indicate less symptoms of anxiety or depression, or if you will, better mental health. And the pandemic appears to be having an extreme impact on our youngest adults. The survey only goes down to 18. There's some data from other sources that says this is very true if you go down into the middle to early teenage years. But over 45%, almost 1 out of every 2 18 to 29-year-old is reporting some clinically significant symptoms of anxiety or depression. And we stair step down to the 30 to 39-year-olds and so on. But it looks like that the mental health problems associated with the pandemic are disproportionately affecting our younger adults. And I just taught right before I came over. I ran this by my introduction to healthcare class at Husson. So these are all mostly college first years. I would say they were not surprised. I asked them what to do about it, and they said if you all can figure out how to make their tuition free, that would help a little bit. But it was striking to me how much this was not a story to them. They are all nodding their heads and saying that this is familiar. I can see a question popping up in the chat. Do we know why? We're still trying to study that. I would say probably the leading theory is that the impact of the pandemic has disrupted both the day-to-day functioning and the career and life trajectory of young people disproportionately. They're really feeling off stride. Some other people putting up isolation, certainly that is true. Let me talk, I'm going to shift about now. Part of what we can do is for those people that have very significant problems, we try to get them into treatment. But I would say for a couple reasons, we are looking at employers to try to help us with that. And I would offer a couple of things. One is that you have these folks, within your sphere. There's some kind of shocking data that depending on what disorder you picked, about half the people with diagnosable mental health disorders never get any treatment. So they never even get in the door. The other thing is that we start to see that employers can begin to help people manage their stress so that they don't develop clinically significant symptoms of depression and anxiety. And I pulled one study which just looked at what do employees find helpful in reducing their own stress. This is pre-pandemic, but I think that the trends here probably hold. So if you ask employees, what could my boss or my workplace do to change stress, to reduce stress, right? A couple things, sometimes you can and sometimes you can't. You just ask them free form and see how many respond. So a lot of them say if you can change their job or their work role. Some of them would like a new boss. That would help reduce stress in certain situations. But more interesting to me, number 3, doing something specific. So any specific intervention to reduce stress. If people say they're stressed, trying to respond in some way that they can tag your response to what's stressing them out, was cited by over 10% of the people, just asking them that open-ended question. And then number 4, here's I think where a lot of our employee wellness or stress management kinds of things can really help. People said that giving them more ideas of what to do in one of 2 ways is helpful. Positive coping strategies are those things which are going to help me deal with the stress I'm feeling right now. So how can I deal with it right now? The second thing is protective coping strategies. So we find out that people who are more, if you will, psychologically resilient going into a difficult situation are less likely to get clinically significant anxiety or depression. So we can do 2 things for our employees. We can help them cope right now, and we can start to build up their psychological coping skills and mental health resources so that when they hit that most difficult period, they are more protected and know what to do. And then we can move on to our next slide. The last thing I would say that the research is telling us is that employees really notice whether the leadership in their organization or their own work teams actually, if you will, walk the walk. There's a lot of data that even things like a senior level management team doing good stress management and self-care as part of their job trickles down. So one of the things that I've seen a lot of places incorporate real well, there's a lot of kind of 1 minute to 3 minute relaxation exercises. And I've seen organizations, there's data to support this, just using it at the beginning of every meeting. It does not take very long. These are very well done. I put one up from Headspace. But I would encourage you, if you want to use a takeaway from this meeting, to bring that into your next meeting, a large group, and just spend the first minute doing a meditation or a relaxation exercise. It's a good way to take care of yourself during the day. And you start to see people, if you do this repeatedly, look forward to it as a breath of fresh air to just try to de-stress a little bit in the middle of a hectic day. And with that, I will turn it back over to Dr. Gilkey.
Thank you, Dr. Prescott. Our next speaker is Umaya St. Clair, who will speak about the new wave of uncertainty we find ourselves in. Umaya?
Thank you so much. And I appreciate following Dr. Prescott because, working with an employee assistance program, it's so important that we have these employee supports in place. We are hearing from a lot of exhausted and anxious employees, and the hopefulness that accompanied the vaccine rollout has quite honestly faded as Delta's taken hold, and people are really worried about what the fall and the winter will bring. So with all this uncertainty, people aren't really sure if the coping mechanisms they used last year will be enough to sustain them in this time around. So I really wanted to focus on just 5 things to keep in mind as we enter this new phase. And the first being, we do know a lot more about COVID. We know a lot more about how it's spread, how to differentiate between low and high risk activities, how to protect ourselves, and how to go about daily life adapting to the constraints that COVID has necessitated. We also really know a lot more about working creatively, right? The innovations and resourcefulness that businesses and organizations have demonstrated over a really short period of time have been truly remarkable. Employees have demonstrated that remote work is often possible and that it's usually better both for employers and for their staff when outcomes are really emphasized over hours worked. And of course, in environments where remote work is not possible, employers have figured out ways to keep their employees and their customers safe. This is huge strides that have been made in a short period of time. And so, we have proven our resiliency. It's important to just take a moment and acknowledge how much bending and growing and stretching we've all been required to do. The difficulty of this has been immense, and we've handled it. So when the next dark day comes, we can say, I've been through hard times before, and I can live through hard times again. It's also important, at the same time that we're patting ourselves on the back, to really check in with our hearts, right? We are not superhuman. We've all had some of those melt on the floor moments when we've realized we just can't do one more thing, right? So we have to prioritize rest and refueling, tending to our really basic needs of sleep, water, food, right? There's this chronic nature of this pandemic that requires stamina. And stamina requires sustenance. And when our stamina fails, which it will do at times, it's really okay and important to ask for help. And like Dr. Prescott mentioned, employee health programs can really help with this. We have resources through Workforce EAP, which you can access to help support stress management and resiliency. So please give us a call if you're looking for services. You'll also see on this slide information about the state's Strengthen Me program, which is another great resource. And then lastly, we are going to drop some balls. When you're juggling it all, it's okay to do so. It would be impossible not to. I heard from best-selling author Nora Roberts one point. She was asked a question about the work-life juggling act. And this is pre-pandemic, but I felt like it relates. She said, the key is to know that some of the balls you have in the air are made of plastic and some are made of glass. If you drop a plastic ball, it bounces, no harm done. If you drop a glass ball, it shatters. You have to know which balls are glass and which are plastic and prioritize catching the glass ones. Sometimes in order to catch a work glass ball, you may have to let the kids have a little more screen time than you'd like. Other times, in order to catch a kid glass ball, you say no to a work meeting that isn't a high priority. And pre-pandemic, many of us were really accustomed to keeping all the balls in the air and beating ourselves up if one dropped. We can't do that anymore. We have to be realistic with ourselves about what we can and we can't do, acknowledging that we're really doing our very best under very difficult circumstances. Thanks.
Well, thanks, Maya. Next is Dr. Singer, who will speak about seniors' mental health. Dr. Singer?
Thank you, Dr. Gilkey. And Dr. Prescott and Yamaya were great setups for my little talk that comes at the end, and I'm talking about late life, older adults. We have two programs here at Northern Light, the Mood and Memory Clinic for older adults and the Alzheimer's Disease Research Program. We're a statewide resource. I just wanted to introduce you to my team, which I'm very proud of. Next one, please. Even before, long before COVID, social isolation, particularly in older adults, was recognized as a critical determinant for health and well-being, or risk to health and well-being. I edited a textbook with Len Kay at the University of Maine a few years ago and was shocked when I reviewed the literature and found that social isolation and loneliness through adult life had the same impact on health, a comparable impact to known diseases like diabetes and hypertension. But of course, during COVID, everyone had to isolate to some degree. And so this has become a really hot topic, and an attribute and an attribute of the mental health risks that COVID has had on us all. Next slide, please. So older adults, in some respects, you would think might be at greater risk for mental health effects from COVID. They're more socially isolated to begin with. Many are anyway. And one point I have to make is that old age is really not one cohort. It's really essentially 3 generations. The 60 to 80 group, the 80 to maybe 95 or 100 group, and then the people over 100, which is actually the fastest growing cohort in our society. There aren't a lot of them, but it's a fast growing group. Very different generation than the younger groups, and even the 60 to 80s are very different than the 80s to 100s in terms of their reaction and response to COVID. They are more likely to be dependent on others, especially that 80 to 100 group, much more vulnerable to severe consequences of infection, more likely to be living in congregate centers or residential centers. And particularly in the 80 to 100 group, have less internet connection and perhaps be less savvy about internet resources. And those people at greatest risk are those who living in long-term care or congregate living settings where social isolation was not really possible from other residents or staff, or if it was imposed on them, they had to stay in their room, which had a huge impact, and they couldn't see family and friends. Very, very difficult situation. People who were recently widowed are also at increased risk during the pandemic. And dementia caregivers. Dementia caregiving at its best is an isolating experience, but it's been particularly difficult during the pandemic. Now, it's generally unclear. We don't have really solid data on the overall relative impact of the pandemic on the mental health of older adults, but Dr. Prescott showed some recent data which are consistent with my experience and the little I've seen written about this, is that older adults may actually be adapting better to the social isolation of the pandemic, with the exceptions that I mentioned: long-term care, recently widowed, and dementia caregiving. And the reasons for this lower rate of anxiety and measured depression in these cohorts, maybe, this is speculative, but I think there's some evidence to support this. In general, older adults score lower on measures of depression than younger adults do in epidemiologic studies. It's not that necessarily that they're at lower risk, but they may score lower in epidemiologic surveys. They actually are at lower risk in some respects. Healthy older adults tend to be the happiest, happiest of all people. Lainey, can you go back, please, to the previous slide? Yeah. The other issue is that older adults are less dependent, in general, less dependent on large social gatherings for their social contact and fun. They go to fewer concerts. They don't go to fewer large parties. They're more dependent on smaller group gatherings. And perhaps this is relevant to older adults tend to have lower levels of death anxiety. They worry more about disability than about death. Okay, Lainey, next slide, please. So there have been other adaptations that I think have helped older adults adjust to the pandemic. Many of them have had young adult children moving back from cities to get away from centers with more higher rates of COVID infection. I was one who benefited from this. It was great having them with us for a while. The pandemic has required older adults, particularly in that perhaps 75 and up group, who perhaps didn't have internet and video conferencing skills before the pandemic. Now they're pros at it. and that increases their access to family members, at least through social media and video conferencing. They've had expanded options for food and service delivery. More service delivery options have, you can get everything delivered now, and particularly whole meals. So that's been a good thing. More expanded options for online activity, like online yoga classes and Tai Chi classes. And people have adapted to have their book groups and other small gatherings on Zoom, and people are getting used to it. And then finally, of course, there's been greater access to healthcare consultations for rural and less mobile elders. We have some people who used to travel 3 hours each way to come to our clinic, and now we have more options for seeing them remotely. So those are some of the other things that I think have led to successful adaptation of elders. I don't want to minimize the suffering that many have gone through during the pandemic and continue to go through, but I think as a group, they've been remarkably resilient. And Yumaya made the point that people have been through hard times before can rise to the occasion again. And I think that's especially true of many older adults.
So thank you, Dr. Singer. So I'll draw everybody's attention to the chat room, where there's been a really wonderful dialogue going on in the course of our session today. And I'll give you an opportunity to look at that, read it. Some questions did emerge during that time, and our panelists directly answered it by typing out a response. I'll focus on the Q&A part. So for this next segment, we will ask our panelists to answer your questions. Just a reminder to place your questions in that Q&A box. Okay, and we have all of our panelists should be joining on with their video on. And the first question is for Dr. Jarvis, and I'm going to actually put my 2 cents onto this one. So anecdotally, many colleagues are telling me that comments like, you'd be amazed how many 30-year-olds are on ventilators. So with that setting, here's a question. Are the patients in the hospital over 65 with chronic diseases like they were last year? I know you touched on this, but you might want to elaborate a bit more. Jim?
Yeah, so we continue to see, obviously, individuals who have underlying conditions that put them at risk for severe respiratory conditions, COVID-19 being one of them. But we are seeing people who are being admitted with COVID-19 who do not have any pre-existing condition, particularly the one that we used to talk about a lot, which was being overweight or being obese. We are actually seeing that is not the predominant number of individuals who are coming into our hospitals now. And unfortunately, we continue to see anecdotal stories and unfortunately real-life stories that we can relate to of younger people who have succumbed to COVID-19. There's an article just today published about a husband and wife who unfortunately got misinformation, did not get vaccinated, and both of them died. And their son is out there now advocating for vaccination and for people to listen to the right sources. So we know those kind of stories are happening. Just today, the United States went over a threshold mark that we never thought we'd want to see, which is that 1 in 500 Americans have died from COVID-19 since the pandemic began. I'm going to say that again, 1 in 500 Americans have died from COVID-19. That's an astounding number, and things that we would talk about in wartime and things like that before. This is a devastating disease that's affecting everybody.
Yeah, thanks, Dr. Jarvis. The next question is for Dr. Marnick. Why do a small number of people who are fully vaccinated get severely ill and die? And then there's a follow-up question. What's different immunologically about them compared to most people?
Yeah, so we are seeing that a lot of the people who are getting breakthrough infections who then go on and unfortunately pass away are individuals who are elderly or immune compromised. And these are individuals who we know don't make a normal immune response to vaccination. So it's been an area of active research. I did my dissertation next to a lab that was trying to study how we could improve the efficacy of vaccines for our senior citizens. And it's a problem that scientists are still trying to figure out, where as you age, your immune response weakens and you then produce less a robust immunity. So they still have some immunity, it's just less robust compared to those who are younger. And then the same is true for those immune compromised. We know that certain individuals on certain medications are not mounting an antibody response at all, or are mounting it very weakly. And this is why the FDA and the CDC has recommended that third primary series dose for a lot of those individuals who are immune compromised.
Great, thank you. The next question we have is for Dr. Singer. And actually it looks like two parts. Is now a good time to focus on the internet connectivity for elders, specifically making sure they have equipment they understand how to use and provide encouragement to connect with specific interest groups? So I think you brought up, special interest groups that people can connect with. So what's your thoughts there?
Well, absolutely. I think older adults in general have been very mindful of their risk. And so really do appreciate the ability to connect remotely with friends and family and maintain social connections, and to do telehealth visits with providers. So internet connectivity remains a problem for a lot of rural elders, and many even who have live in regions where there is good internet access may not have it to their home because they didn't think they needed it. So for telehealth visits, they may have family or friends come over with their devices. Yeah, a lot of them don't even have smartphones. So yeah, making sure that that we reach rural areas with internet connection, and making sure that older adults have not only connection, but also a device to use, becomes a life and death matter actually during the pandemic.
Great, thanks. Dr. Marnick, I have another question for you. What would you recommend to parents whom share children together, yet different opinions on vaccinating their children?
Yeah, this is a hard question. And I think that you kind of have to figure out exactly what is the primary reason why that individual is hesitant. So I think right now we're seeing that we're just inundated with all of this misinformation. And I've had a lot of conversations with people who they just don't know where to find accurate information. Sometimes they don't feel comfortable talking to their physician, or they aren't sure where to get those sources. So if it was me, what I would do is I would try to find out why that partner, that parental partner, was hesitant, and see if I could help them find resources that maybe could then address their concerns. But otherwise, I think that's a hard position to be in. And if it's a custody situation, then you may need to then go to other resources in terms of figuring out how you can get your child vaccinated if your partner doesn't agree.
Excellent. Well, thank you. Next question is for Dr. Prescott. The graph that showed less symptoms of anxiety and depression in older age groups during COVID seems opposite of the perceived risk of getting COVID, meaning becoming severely ill and dying with greater age being the key factor. What do you think explains this?
That's a really good question, and I would welcome perhaps Dr. Singer's suggestions. One of the things I think, and I think Cliff pointed this out nicely, is that older people tend to have less death anxiety. So the worry associated with the pandemic perhaps may be less as older people than young people. The other thing I think, some of the data I've seen is that while younger people, their lives, they're not necessarily more isolated. It's that their normal activities are disrupted. Or as my daughter, who is living at home, said, it's not that I haven't seen anybody, Dad, it's that I've seen too much of you, right? I'm not getting to see the people that I want to. And I think what's happened is that their normal activities, their normal social groups, and their life trajectory all have just been knocked off center. And I think that's what's causing they ask questions like, will my life look the way I want it to look? Will I get to finish college the way I want to? Will I be able to work? So I think that's what's pumping up the depression and anxiety, perhaps more than the fear.
Yeah,
itself.
That sort of makes sense. That certainly makes sense. Dr. Singer, did you want to weigh in quickly in the next 30 seconds?
No, I think David said it perfectly.
That covered it? Okay,
Yeah,
great.
yeah.
Thanks. I think we have time for probably one more question. This one's for Yamaya. The example of plastic and glass balls was very helpful. Most of us, as you said, juggle all the balls. Recognizing that people are tired and being worn down, is it worthwhile to discuss with employees the various balls they are juggling and set priorities, like agreeing what plastic balls are okay to let bounce?
Yeah, it's a great suggestion, and it takes time and effort to have these conversations, right? But it's time well spent, because so often we know that many of us live in our heads, right? And it's the swirling in the heads that can really help provoke the anxiety and the feeling of being so overwhelmed that we're paralyzed, right? And so it's often, you know, those of us in the mental health field are often helping people, you know, process things, externalize them, and even just writing down lists of all the things that we have to do can be really clarifying to say, okay, yeah, I see it all here. Some of it will shatter if I don't hold it up, and others I can let bounce. But having a leader help to differentiate those parts of work are really helpful. And then maybe having a partner or friend do it for the other aspects of personal life.
Excellent. Thanks. You know, I might be able to squeeze another one in with your help, Angela. We are immersed in our mental shortcuts, living them every day. How do we self-monitor to be on the lookout for these biases that could harm us?
That's actually a great question. One of the first things we want to do is just become aware that these things exist, right? So as soon as we become aware that these kind of mental shortcuts exist, you know, we can start asking ourselves, hey, am I using one of these mental shortcuts right now? And if so, is it helping, or is it maybe giving me some misinformation, or maybe I'm missing an opportunity to think more clearly about a situation or a circumstance? It's really about developing first that awareness, though.
Yeah, great. Well, thank you. So, you know, I sound like a broken record, but boy, we could really go on for another hour for sure. But we're near the top of the hour. So we've included some tools for you at the end of this presentation. Thank you all for joining us, and thank you to our panelists. I hope this hour has been a help to support you, your employees, and our communities to safely manage through this pandemic. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be on September 30th, so 2 weeks from today. Our theme for this session will be navigating new information to support our employees' health. We'll give updates on the virus, vaccines, boosters, flu vaccines, monoclonal antibodies, mandates, and supporting mental health. There's so much going on, and we are determined to help you keep up to date. We will send you the link for this session. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together to promote good health, we will be promoting good business. Thank you, and have a good afternoon.